Hello and welcome to Memory Moments. I'm Julie Anderson. Animals are a big part of our families, but did you know they can also be trained to help those with Alzheimer's and dementia?
Bernie, would you like to pet Jasmine and see how soft he is? Look at that.
Oh, yeah.
Isn't he beautiful? Is he a good worker?
A former farmer with dementia. You betcha Bernie is benefiting from animal-facilitated therapy. He lives at Lakeview Ranch, a specialized Alzheimer's and dementia facility in central Minnesota, dedicated to increasing quality of life through innovative programs.
So we're going to move him over here.
Animal-facilitated therapy is much more than just having animals interact with residents. It helps them in 3 specific ways. One is range of motion. Under the guidance of experts, residents brush the animals in a directed manner. It's an enjoyable way to exercise their arm muscles.
We have some mane gel. It's like a hair gel. Remember Dippity-Doo?
And the residents can achieve measurable improvements.
All right. Documenting is going to be your most valuable tool because it's going to validate your animal programming. So we tend to document both the physical and the emotional responses in the resident.
The second benefit of animal-facilitated therapy is improving the emotional and mental well-being of all the residents, even those with the most advanced dementia. Listen as Eleanor brushes Jasmine and notices he has what she calls a whirl in his mane.
Funny-looking feathers.
Whirl, right there.
Yes, it does.
Yep.
Well, thank you,
You have to go
Eleanor.
to the beauty shop and get that straightened out.
A conversation that may not have occurred without this important, non-traditional therapy. Sherry Eddy and Candace Kistner are trained animal specialists. Together, they make sure the animals are willing to be inside with the residents and that everyone is safe.
What kind of treat did he have?
I don't know.
Oh, is it orange?
Oh, carrot.
And look at, he liked him, didn't
Ho.
he? Here he comes again.
Ho. Okay.
Good boy.
He sure likes those carrots.
What kind of sound is he making?
Slobbering sound.
The smiles show how much the residents enjoy the interaction. The animals seem to like it too, even when they can't quite get a resident to react.
You want to brush him?
For those who can still express themselves, like Lara,
I think it's the highlight of my week. I just love animals. I love interacting, and I think she is fantastic.
she is referring to Jinx, a sweet, patient dog.
Oh, yeah, you're going down to get that one. Very good. There it goes.
Having the animals in the day room of Lakeview Ranch brings all the residents together. Socialization is the third element of animal-facilitated therapy.
There are times where there could be a resident who maybe is kind of off in a corner and not very social, maybe keeping to themselves a lot. And the animal, again, we use as a tool to bring the resident in forth with us and use that as a conversation piece.
Tell him, get it, Jack.
Jack, the second therapy dog at Lakeview Ranch, is definitely a conversation starter.
Can you tell him? Tell him, get the ball.
Oh,
Yeah, there. Bring it here. Say, bring. Tell him, score. Tell him, score. Did he put it in your basket?
Okay. Now this
That's a
time I
good
want to
trick.
hear your voice, Lyle. Let's use your voice today. You ready?
Okay, tell him, get the ball. Say it loud so he hears it. Tell him, get the ball.
No one but the resident really knows what it's like to have Alzheimer's and dementia, but loved ones can sense the emotional toll it takes. Animal-facilitated therapy can help residents feel better about themselves.
We have noticed that our residents, it makes them feel important.
Just watch as Ray interacts with Jack.
I'm going to put Jack on the floor, and then what I'd like, Annie's going to help you, and we're going to tell him what to do. So you're going to be the leader today, okay?
Well, that'd be nice.
Okay,
Nice, good.
I like to be the leader.
All right. First, we're going to throw the ball.
Oh.
And then we're going to tell him him to get the ball, you could say, "Get it, Jack."
You tell him, "Get it, Jack."
Sometimes it's hard to understand Ray, but his voice comes through loud and clear when Jack comes to him for praise.
We're going to give him a treat.
Look at that.
He did a good job, didn't he? You're a good dog trainer, Ray.
No, he's a pretty good dog.
Okay, that's
Pretty
good.
good dog.
A good dog he is, along with Jinx and Jasmine. Lakeview Ranch provides this alternative therapy because it works. Treating Alzheimer's and dementia must go beyond medicine and meet the residents' emotional needs.
Animals seem to have an ability to decrease depression and anxiety, and which in turn then is kind of lowering their blood pressure and stabilizing some of those health effects.
Don visits his wife Bernice nearly every day. She can no longer talk about the days when they had a steak-stealing dog named Champ.
All of a sudden I saw the dog running with one steak in his mouth. He'd already gone through one, and he was on his second one. Bernice was not too happy with me.
But he sure likes to visit when the animals are around.
I think every farmer probably had a dog. And a lot of these people probably from the farm, they can remember their dogs when they were young.
Dogs, horses, goats, and more. Lakeview Ranch and Animal Facilitated Therapy are providing that extra assistance you just can't find in most facilities.
Okay. Everybody say bye, Jasmine. See you later. You say bye, Jasmine? Bye, Jasmine.
Yes, sir. Thank you.
That was so nice as he did. He's wonderful, isn't he?
Judy Berry is the founder of Lakeview Ranch. Judy, what makes Animal Facilitated Therapy so special?
Well, it gives us an opportunity to connect with residents on an emotional level and create positive memories and positive experiences that keep them in touch with today. And
it's also something they just can't get everywhere else.
Yeah.
I mean, your facility is very special.
yes, and we do take it to another level. We do it with farm animals, not just house animals. So it is something that will bring a person, even in the very late stages of dementia, back in connection.
Absolutely. And we want as many people as possible to share in this. So please share this story so that as many people as possible can learn about this alternative way to provide therapy to those with Alzheimer's and dementia.